private sector is more than willing, and we have been saying these things at various fora, CII, Wiki, Association, etc., etc. And once in a blue moon, we do meet, responsive senior officers of the government of India. But there has to be a constant kind of a, system which has to be involved. Because now it is a no-brainer that PPPs are good and we have to be on board and we have to work with the government. That's all understood. But how do the private sector can only suggest that the government or somebody senior enough in the government, say in the health ministry or in labor, etc., or planning commission, we don't know. There are lots of bright ideas on the table here, but they don't get transferred because of a lack of a system, which should be there every now and then.
Okay, so how do we address that? That's the next question. See, we are sure that we have around 4 lakh plus crores coming over. 2.5 or 3 lakh should be a very big amount for this country. So how do we Ashok ji probably
maybe let me make a couple of comments on that. First issue is going more closer, both in the formal and the informal way. And like I can put some of the examples, what we are doing is, for example, in the Central TB Division, we have really constituted a national task force, say involvement of the corporate, hospital and the private sector. And wherein we have really invited members who are not only in the corporate but also willing to work and take the things. And that interaction on a regular basis is a must. Now there needs to be an informal way also. And today is an ICT era. I think government has also made it mandatory that so every institution, for every senior officer, we have to have either a website and a telephone in that. One thing I wanted to make a suggestion here, which maybe Mr. Rajendra will like to take, that here we have heard many of us are doing our excellent work, but probably we don't know how to tap them. I think we need some kind of a common portal which you can take where everybody whosoever is doing can register that kind of interaction into that portal. And that portal can be publicized and we can really have
Sam, welcome.
Hello.
Hello. Hi, Sam, welcome. Good afternoon. And thank you for joining.
Hello?
Hi, Sam, we can hear you.
Yes, Dr. Gupta, can you hear me?
Yes, we can, and we are waiting to hear your views now.
Okay, I'm sorry for the delay. It took a little longer to get from the airport. So how do you want to do it?
We discussed yesterday, that...
Can we do it at the other end?
So we have at the other end the top CEO of the healthcare industry. We have the Deputy Director of Health Services. We had Anil Sarup, Joint Secretary, Ministry of Labour, and Sangeeta Reddy just left, And Dr. Reddy came in today morning, and we had Dr. Srinath Reddy, we had Dr. Keshav J.C. Raju, Special Secretary, Health and Family Welfare. So we are waiting to hear your views about what we discussed yesterday on the healthcare and the involvement of sector and what kind of changes should we expect and what should we do.
Okay, if you want, I can just spend 10 minutes giving my view, and we can open up for a little discussion. I hope it is a little formal. I hope you don't mind that.
Yes.
Okay, so thanks. First of all, thank you for organizing this. My apology for being late. Flight was a little late, then traffic. I'm told that there is going to be a lot of traffic in Mumbai because of Ganapati Chaturthi or whatever we have here. Okay, so my apologies. As we all know, health has been a key issue on Planning Commission's agenda in the 12th plan. We have had lots of discussions on health, and this discussion has been going on for the last couple of years. We all realize health is a very complex issue, requires multidisciplinary understanding approach, and there are multiple perspectives as to what is right, what is wrong, what is fair, what is unfair, what is proper, what is not very proper. And we have really not been able to develop consensus on many of these issues, especially when it comes to public-private partnership, when it comes to some of the larger issues on public health, on how to go about modernizing our existing infrastructure. So there is always debate going on, and in the process, we have not been able to put together a viable plan that is buy-in from everybody. This is my view. But we all realize that there are fundamental challenges to provide universal health care in India. And I think it requires focus on at least the five that I want to talk about and existing.
Yeah, sir, we can hear you actually. Sir, we can hear you. Yeah, we can hear you. Please.
Can you see me now? Because I don't see you.
Yeah, we can hear you.
Okay. So as I was saying earlier, the first challenge I suspect is to really improve existing infrastructure institutions. This includes very healthcare sector, existing government facilities, all our major hospitals. When you look at this infrastructure on India and thousands of crores, this infrastructure is basically crumbling. I've been to many family healthcare centers, whether it's a facility, equipment. I believe immediate attention to be paid to modernizing existing infrastructure, because we're already putting fair amount of it here. I've been to many government hospitals, and I find the standards are really not acceptable when you look at overall national income. I don't know how, but I believe a plan to really upgrade this infrastructure. I have to see a plan which says we expect as resources to really build this infrastructure to a standard that is acceptable. Secondly, capacity. We all know that more doctors, more nurses, more paramedics, technicians, and we have not built the kind of human capacity that we need, especially in those areas, as well as in urban areas. Our universities, medical colleges are not enough. The shortages of health workers run into thousands and thousands. So building human capacity is another big challenge. Third area is really the role of CT, where India is well represented all over the world as experts, but we have not been able to build health information systems which include portal for education in local languages, with local content, relevant content, mobile electronic health records, telemedicine, health data centers, and ultimately health information network for some countries. A lot of this, whether it is related to infant mortality, number of TB patients, or any other information, even on isolation, we really don't know how accurate is our data. And I think unless we focus on automating a lot of this information, computerizing this data, make it available to large number of people for scrutiny, I think what we will benefit from the role of IT. So IT is very important factor. Many people have done some good work in the country. I know I've been talking to Dr. already at his team. I have seen some stuff from CDAC, government, hospitals, Wipro has done some good work, TCS has done some work. So all of this work is in bits and pieces there, but we have not been able to consolidate all of ICT effort and really create a national plan for ICT in health. Fourth step, from my perspective, is about integrating traditional health. I am big on this. I am convinced that the modern medicine is not going to meet the challenges of India with 1.2 billion people. We really need to take advantage of the traditional medicine, not that it will solve all health problems in India, but there are a lot of low-cost solutions for preventive healthcare, either food, herbs, simple practices that has been given to us from generation to generation, does have a fair amount of wisdom that we have lost, that we have forgotten, that we have not integrated. Ayurveda is pretty well known, and there is Unani and there are other traditions. But I think we need to go back into these traditions and learn what works, what doesn't work, what can be clinically tried, and what can be promoted. I also believe that we have large traditional health workers who need to be integrated into the mainstream of modern health work. I've heard that I believe Dr. Cardigan described modern health. And this has to change over a period of time. So traditional health does offer us opportunity to reduce costs, improve access, and really benefit people in rural areas. And it deserves a lot more attention than we have given in the past. And finally, we need to innovate. I think Indian systems require Indian model of health delivery. Western models, as I've been saying for many years, are not scalable, are not sustainable because these models are too expensive. So how do we innovate and create Indian models of health delivery systems which are addressing the problems of the bottom of the pyramid, focus on low-cost solutions? And we have some good examples from eye care, from Divish Indian from Care Food, and these three examples come to my mind immediately, but I'm sure there are many others. How do we take these and really innovate in all other aspects of health delivery to really reduce costs? We do need modern hospitals, we do need modern equipment, we do need Western technology. I'm not saying no room for it, but I think we need to really innovate to come up with our own cost-effective solutions. So when I look at overall health challenges, I basically focus on these five. And then there are lots of other bits and pieces. What do we do with cancer, what do we do with diabetes, what do we do with cholera, what do we do with TB, diarrhea, some of this, issues related to mortality, issues related to women's health. All of that is already staring in front of us. But while doing all those things, how do we focus on, once again, improving existing infrastructure for which we have produced thousands of crores? Two, how do we create human capacity that is in line with what we need. How do we use ICT to improve access, reduce costs, get better data, focus on logistics. How do we integrate digital health? And how do we innovate? And for these five, we probably will make a debt. I'm not a health expert, but I've spent enough time debating, discussing, understanding some of these issues. And I believe we need a real focus on health in the 12th class. Because without health and focus on nutrition, we will not be able to provide the fourth quarter part. And if we are to grow at 8 to 10% year after year, we need better human resources, trained humans. But first we need healthy humans. And that is the challenge in front of us. So with this, I want to thank Raju for giving me this opportunity. I hope we can have a bit of conversation on this. But I'm sure you all have a lot more to add and comment on. Once again, thanks.
Yeah. Sam, you will have a few minutes to take questions.
Sure.
Yeah. So Sam, my first question to you is the biggest challenge of bridging the divide in terms of the cultures. You know, one side we have almost kind of double the healthcare budget. Another side we have a huge private sector wanting to engage with the public sector and the government. So what kind of, what view you have on the cultural changes that we need to make from both sides to make these partnerships really working?
First of all, we need to realize that there is a role for both. There is a role for private, and some are doing a very good job. There is a role for government, and government infrastructure needs a lot more focus. But we do need to create public-private partnership, and it hasn't happened in the past the way we would like to see. For example, primary healthcare centers. Does it really have to be run all by government? If they are not run effectively to public satisfaction, can it be turned over to some private in some fashion? I don't know the answer, but I think we need to really look at some of these questions and put it on table. Only by trying to do innovative public-private partnership models, we will learn what works and what doesn't work.
So Sam, next, of course we have a lot of people here, so I'll let them ask questions, and there's a rare opportunity to have you, and I know you're short of time because you have an important meeting.
Go ahead.
Yeah, these are questions.
I'm not well today, I just had got fever last night. So I'm sneezing and coughing, and so I hope you don't mind my interruption on and off. Thank you.
Yeah, Sam, this is Ravi Gupta from eHealth magazine. My question is that you have initiated this whole big program of connecting the panchayats through the rural broadband mission. So how are you seeing that this network can help reach to the poor in the villages? Thank you.
Thank you. Very good question. We have two major networks that we are doing now. First one, National Knowledge Network, which is already built. It connects all the universities and R&D labs, including hospitals and medical centers and all that. And two, connecting 250,000 panchayats. That network, which will be available in the next 12 to 18 months, will be the key to building health information network of our own. So we could create a health information network using connectivity and panchayats. We could have on the mobile phone their health record. At panchayats, we could have telemedicine centers connected to district headquarters or urban areas for consultation with major hospitals. All of this is possible with connectivity. And this connectivity is going to be hundreds of megabits and not 2 megabits. And which will allow you to really do a lot more peer-to-peer broadband video. And that's what we need to provide good talent with this peer-to-peer video. And that's the plan. So I agree that that network will be of great value to help deliver this.
Thank you, sir. Thank you so much for your time. You're coming over in this busy day. And I'll see you later with the outcome of the meeting. And good luck for your meeting today afternoon.
Okay?
Thank you very much.
Thank you very much.
Later. Sorry for a little bit of interruption.
Okay.
Sure.
Thank you.
Bye-bye.
Thank you. Bye. I know we have run into lunchtime and had to do much. So if you have quick thoughts on how to take this ahead, then it will be great, because we need to have an outcome of the meetings that we do like this, because it's not easy to take out a scheduled time, and that will half take.
I have a suggestion to make. Sam has really summarized challenges, and he's brought out at least 5 major areas of interest, which are diverse, but healthcare needs them to be integrated. So if you really have to have dialogue with the government and different departments, this forum can create some core groups in these 5 areas of interest based on the specialization and the industry that we come from, and create a policy document that can be shared, understanding what the bureaucrats are thinking and what the industry is thinking, and how these can be brought to meet each other. So we did a number of exercises. Frankly speaking, you realize many of the members are sitting here on the group that prepared the report in 2009. And it was music to my ears when Sam was explaining these points one after another. Infrastructure development, capacity building, IT, insurance, all these factors are so important to create a robust healthcare delivery network, not necessarily for the BDS alone, but also for the entire country. So think about it. I think these are 4 or 5 areas within this forum, which I am sure is going to expand radically. You could create some think tanks to collect necessary information where they are going, to be able to interact with the government. When we say government-industry dialogue, it means that we are trying to educate our partners on the other side and facilitate them in the implementation of the policies that they frame. So I leave to the judgment of this August group as to how we move forward. See,
Dr.
yes.
Akbar, one of the things in this meeting, since we have a couple of people like I can suggest called Melvin, Melvin is around still? Yeah, he is there. So there are a lot of people who currently work with the state governments, and they have great experiences, and they have increased their base. In fact, English works with the government, his company works with the government as PPP. So now I recall there's a very big program going with the government, and that is mass screenings, for diabetes. So in this hall itself, we have senior people from the entire industry. So just my quick question, if the government is able to give us, this is a thought, it's not an offer rather, it's a thought. If the government is able to give you the strips or the cost of strips, they have been just brought down to little around 10 rupees. How many people in this room will be able to adopt these strips or plan these strips? It would be great to see how many people will be willing to do that. Yeah?
You're talking about screening
Yeah, for diabetes.
at 10 rupees cost across the state.
So they have already figured out the cost of the company that they have done it. So if they say, see, the compulsion is that in as much as they did 10 billion in 9 months, if private sector gets in, there's a possibility to make it the real number that was thought of 20 crores.
I can say yes, we can do this screening.
Great. So how many other people would like to contribute? See, what we want to do is, we can create thinking. I was with Dr. Nagpal on his core committee and I had discussions with Sam Pitroda on the PPP, and he gave great inputs and he has become an advisor for that. But out of this meeting, probably we would like to put action points which we can talk to the ministry and say, this is what we are willing to do. How can we work well? We have with us very senior person from the ministry also. So initially,
I mean, like,
Can I share some thoughts on this? Those of you who are not met personally, my name is Dr. Arvind Lal. We run Dr. Lal Fat Labs. And there are two industry representatives from my side, which is pathology testing. One is SRM. And just raise your hands, Sanjeev. So, between us, we have been deliberating this point, and we've gone even as high as the Honorable Minister himself, who has made, actually, for those of you who may be hearing this or who may have heard earlier, but the Honorable Minister made a point on the floor of the United Nations last year, on the 19th of September, about the NCDs, the non-communicable diseases. And he had, rolled out this plan that in another 6 months or so that they would be testing about, maybe 10 crore people and 15 crore by March, etc., etc. And I went and asked him this question, and I said, what was the plan a success? So the minister was quite, forthright. He says, no, it was not a success. And it was, the same thing which Rajendra is, posing to us, that glucometer strips, we gave it to people and we should go and start testing. Now, I then told him, I said, how would you like to do it? He said, well, we are thinking about it, and it's for the Ministry of Health and Family Welfare, especially the NCD kind of a thing. But from the private, sector, we got the following to offer. And on our own, then we went, I think this is from the ages of 15, that I went and approached Dr. Srinath Reddy. And the reason was that you cannot, just have a study armed with, I'm saying, very crudely from my point and Sanjeev's point, you give us a syringe and needle and we start going to different states and start taking their blood or on a glucose strip. So the idea was that, everybody may have heard, some of you may have heard of Framingham Heart Study, which was conducted, in Massachusetts in 60s and 70s and whatnot. And that is, might be for the first time in the world that anybody was able to associate that high cholesterol is indeed associated with coronary artery disease. So my point was that if you are going to be sending people, what is the nature of that study? And for that, I took my own initiative and I went to meet Dr. Srinath Reddy, who has promised to make a study. It should be like a clinical trial. There are, some people who know what it is, and there are many people who know what clinical trials are. And to involve then people like us and Sanjeev and other labs. And what we can bring onto the table is 400 accredited labs in India, which is not a small number. And we don't have the problem of, accession. I mean, the affordability of CGHS rates we are doing and quality is assured of. So what I was thinking was, and Dr. Srinath Reddy this morning has also agreed that we are on the correct lines, that he is going to make a study, a proper study, like a clinical trial. And he will give it to us. We will have to get it vetted by the ICMR because the Ministry of Health may not look at such studies very kindly, coming from outsiders. So ICMR probably would be the right, forum. And with that, we go to approach the Ministry of Health and Family Planning, and they and the Planning Commission, because this is going to be a huge study. I mean, my first gut feeling was when I discussed with the officers of PHFI, was it cost at least 40 to 50 crores. And this is not a small study, and we don't know what it's going to cost because this has to be freshly written by Dr. Srinath Reddy. So, what my suggestion to this, group, executive group is that we wait for him, let him write down the study, and then we share it. As long as we go along, we will share it with this forum also. And when it is needed, I can be assured I've got the personal, yes from Mr. Shirindra Mohan Singh and from other, lab people in India, that we would also be able to, spend a lot of money on this just for, as a CSR. So we are highly willing, provided we know what we are doing. Dr. Ashok Kumar to, comment on this.
Yeah, surely, actually this partnership, because, for example, let us take an example of NCD itself. We know that there's a large quantum of the health, non-communicable lifestyle problem we have. And to begin with, our Honorable Minister said, let us start implementation in 100 districts. And then anybody after 30 years and above age has to be screened for sugar level so that we can identify diabetes. And then the provision for the management of diabetes will be done at the block level, at the community health center level. So all these people who are found diabetic, they can be. Now, 100 districts, the program has already started in the first phase. And then gradually we are going to increase. Target is 650 in all districts we have to go. These 100 districts are in 20 states at the moment. And obviously, we need to expand in a very fast way. So that kind of a partnership is really required from all the private players in the country. And Ministry will be definitely more than happy to liaise on that particular issue. There are a number of other issues also. It's not only the diabetes alone. There are a number of other issues that are coming, like tuberculosis is another one of the major public health problems. It's one of them. And we are again going for the universal access or to detection of the cases almost to the level of, say, at least if not 100%, but at least 90%. Against what we are achieving, say 71% with the new sputum positive cases. And our treatment success rate is, say, around 88%, but still we need to go. So even the diagnostic, the problem of drug resistance, for instance, which needs sophisticated kinds of laboratory for culture sensitivity, we definitely want to expand in the pan-India issue. But nevertheless, the diagnosis of tuberculosis based, for example, on the sputum microscopy, the very simple, cost-effective test and the quality test, we definitely are looking for that. As a matter of fact, we have to screen millions and millions of people for that, then only we come. For 8 patients or 8 people we screen, then we get one case. Just to tell you. And we are expecting that almost 2 million new cases of tuberculosis, for example, they are occurring into that. So, in order to get 2 million, multiplied by another 8, so that's the quantum of large number, quantum. And for that, obviously, large number of partners have to really come in. And I was just discussing, for example, the number of health informatic issues. ICT role is there. We still have a paper base from the most peripheral level to the district level. And this itself is time consuming. I think we need to very promptly move into some kind of an electronic mode into that system. And for example, in tuberculosis, the help of the Ministry of ICT, when Honorable Minister Mr. Singhal really was kind enough, RNDC, we've already launched a web portal on 15th May. Every case getting detected in the country is getting digitalized in that. So, still the devices at the most peripheral level, we don't know what devices, whether it's a handheld computing device, or now we do have a revolution of the telecom system, so we need to even get telecom people into that. And that's an issue for the management of the information and the quickness into that. So we're looking for that. Diagnostics, we're still definitely looking for more diagnostics. And I'm sure you know that, I'm again quoting example of tuberculosis, we have banned serological tests, which were not consistent. And the ban has come for both import, manufacture, distribution and use. And there were almost 73 or 75 these tests were being used, which were not consistent, and public or people were being misguided and were made to shed a lot of money. So we have banned it. But at the same time, sometimes, we really request from the private sector that once we ban it, so let us really execute it. Now, you know that notification we have also done, for example, in tuberculosis. We have made TB a notified disease. And as a result, we are expecting anybody, whether private or government, whether clinical or lab, whosoever is diagnosing or detecting tuberculosis, they should report to designated district level, respective district or corporation level authority. Now this is again very important actually. So this is again a very important partnership to promote these kinds of issues. I think like this probably we can take number of such initiatives. You know, I was just talking during the tea time that number of interventions are being tried by our private corporate sectors. But unfortunately, those things probably either not coming directly reaching to those who are implementing. And as a result, though we are investing, but our partnership has not grown. So I was trying to think that why not we make an effort, try to create a web-based portal wherein people can, fill in that what kind of contributions, innovations they are putting in. And Mr. Sam Peter also says that it's a time for innovation and utilizing those innovations in a most meaningful way. So first